Welcome to this Fast Learner video. Today I will explain you the different settings available in your PC-controlled automated Amplivox Audiometer. We will start with reviewing the available test frequencies. You can disable 125 and 250 Hz as well as 1.5 and 8 kHz. Some clinics choose to skip 125 and 250 Hz in order to save test time, as disorders in the higher frequencies are more prevalent than those in the lower frequencies. It might be useful to include 8 kHz in your test battery, as, in some cases, noise-induced hearing loss can be already seen at 8 kHz, whereas the level at 6 kHz still appears normal. When running an auto test, the start level can be defined and either be set to 20, 30, or 40 dB. The BSA recommends to start with a value of 30 dB. Another test setting is in regards to the patient response behavior when conducting an auto test. In order for the algorithm to ensure that the patient really heard the tone, it is required that the patient responds to the same level in either 2 out of 3 or 3 out of 5 cases. The setting 2 out of 3 will allow the test to be conducted faster. However, the 3 out of 5 option might guarantee a more reliable result. Let me give you an example. First, the tone is presented and the patient hears the tone at 40 dB. In the second approach, the patient already responds at 35 dB. In the third round, the patient confirms the threshold at 35 dB. These 2 out of 3 similar responses are the criteria for the level to be stored as the patient's threshold. When looking at the 3 out of 5 test scenario, 3 levels have to be identical from 5 answers in total. An auto test sequence will always start at 1 kHz and then continue towards the higher frequencies. When selecting omit repeat frequencies, 1 kHz will be retested after the high frequencies have been measured, before finalizing the test sequence with the lower frequencies. Sometimes it might be challenging for the subject to give reliable responses to the tones heard. This could be, for example, erratic responses from the patient. If the patient does respond irregular, 4 different options are given for the computer test to react to this unexpected behavior. When selecting Do Not Repeat, the tone will be presented only once before the test will be either interrupted or the frequency will be skipped. Repeat Once will present the level 1 more time. Repeat Twice will present the level 2 more times. And Repeat Thrice will present the level 3 more times. As mentioned earlier, if the patient continues to respond irregular, the current test frequency will be skipped and the next will be measured, or the test will be paused. In both cases, the operator will receive a notification. Starting with familiarization will give the test subject some training sequences before the actual test phase will start. This allows the patient to get used to the test flow and feel more secure, leading to more reliable responses. Last but not least, a test finish sound can be activated to inform you, the operator, about the finished test sequence. This allows you to prepare further tests in the meantime or work on documentation without losing the focus on your patient being tested by our system. I hope you enjoyed this Fast Learner video. There are plenty more videos on our YouTube channel, so please feel free to subscribe. See you next time. Bye!